back to Stay Tuned, supporting transition age youth. This podcast is brought to you by the Transition to Adulthood Center for Research at UMass Chan Medical School, Department of Psychiatry, and in partnership with our research sponsor, the National Institute for Disability, Independent Living, and Rehabilitation Research. I'm your co-host, Emily.
And I'm your co-host, May.
Today, we're joined by a very special guest, Scott Bryant-Comstock. Scott, do you want to introduce yourself?
Yes, I am the guest, Scott Bryant-Comstock. I'm really excited to be with you guys. I have followed your podcast from afar, and I'm just thrilled that you're doing this. I'm also thrilled with the work you're doing at the center as well. I am the former, because it's closed, to the head of the Children's Mental Health Network, and I know we're going to be talking a lot about that today. Currently, I spend my time as a death doula, working with individuals who are transitioning in hospice. And so I've taken a very different path. Can talk about that as well if you wish.
Wow, that's really interesting. I didn't know that you were doing that now, but that's cool. And I'm glad that you listen. I didn't realize that you were listening to our podcast either.
Got to stay current, Emily.
Yeah, thank you. So, yeah, because your name is like very well known in the mental health field, but some of our young adults listening might not be familiar with your work. So, for anyone who's listening who hasn't heard of you, what would you like them to know about you?
Oh Lord. Well, my name is well known only because I'm as old as dirt. That's the main reason it's probably well known. But yeah, this is such an interesting question. I think what I would want people who listen to your podcast to know about me is my life in this work in the mental health field. I've been involved in the mental health field for 45 years, which is kind of a long time. And is that I've always approached anything I've done with the ethos that I'm going to embrace my mistakes, and I've made a ton of them. Trust my gut, follow my passion. I kind of have this internal compass that always tends to point east when everybody else is going west. And that is that's a wonderful thing, and it can also be a difficult thing. So, I mean, I'm happy to talk about that journey if you wish. You want me to touch on that, sort of what got us to here today?
Sure, that'd be great.
All right, here we go. So, I started in this field really as a youngin', 19 years old. I was living in San Jose, California. I'm from California. And, the world was so different then than it is now. And that's part of what I'm excited about with what you guys are doing. But the world was very different then. We didn't have cell phones. We didn't have the internet, none of that stuff. And as a young adult who was trying to figure out a pretty messed up childhood, I sort of threw myself into working first at a halfway house. We had these halfway houses in San Jose. And I look back and I just laugh because I was so young, 19, 20 years old. And as I think about it now, but California had gone through this period where when Ronald Reagan was governor, this was long before he was president, had basically emptied the hospitals, the state mental health hospitals. And so San Jose, the town of San Jose, and especially around the campus of San Jose State, it became this mecca for people who had serious mental health challenges, but nowhere to go. And so you had this weird dynamic of this influx of people into the community. What it meant for me as a young student was all these jobs started popping up. There was a program called CETA, and I can't remember what the acronym stands for, is California Employment something something. And that's how I started to get involved with these efforts. With the halfway house, it was a CETA funding that funded me. So I worked at a halfway house. I ran a transition group in a psychiatric hospital for people who were coming out of the hospital into the community because there was such a press to do that. And then I did one-on-one work with a young man with severe schizophrenia, and he was just medicated up the wazoo. And I did that as a private venture, if you will. His mom paid me, and I hung out with him, and I won't say his name, but he taught me so much about what it is to be human. And he taught me that sometimes the answers to the real pressing problems are not within the system. Sometimes you have to go outside of the system and you have to create something new and different. And that was really imprinted on me because what, by the way, it wasn't a success story. I wasn't able to quote unquote fix him. I think that's what his mom wanted, but I was able to, at least in the time I was with him, which was about a year and a half, introduce him to some, what, who knows what the word normal means, but introduce him to the normalities of life. We used to go to listen to music at a kind of a coffee shop slash bar place, and he was a big guy, and as with a lot of young people who develop schizophrenia right around that age of 19, 20, he was a brilliant student before, he was a brilliant athlete, he was a black belt in karate, and then of course all that went away. So you have this shell of a person that the outside world looks at and is shunned by, and uh, really repulsed by, because he used to smoke cigarettes. All his fingers were burnt, and he had this chopping motion that he would do constantly. He wouldn't bathe. His toenails, his fingernails were ridiculously long. So he presented this image of grotesqueness to the outside world. But I said, the hell with it. Just get in the car. We're going. And we would go and do these things. And it was, guys, it's like, you think of a little candle burning on the inside that's covered by just mess and stuff. And we'd be sitting there in the at the prune yard and listening to music, and he loved music and he loved me. And you'd see this little glimmer, and yet it was being just shut off with all this incredible amount of medication that the doctors were giving him. And he was just drugged like a zombie. And I was never able to break through that, and nor was I ever going to be able to break through that. But I learned a lot from him about how to navigate systems, because he was involved in a lot of systems. I learned a lot from my time running the transition group at the psychiatric hospital. And by the way, I had no business running that group. I was I was a student, but there was such a need in San Jose, and it's interesting. I think back about it now. It was such a blessing for me as to be in that environment where there were so many issues and so much need. That's where the term the Thorazine shuffle became very popular, because you'd see these people walking along the streets of San Jose just completely zonked out. So great idea, let's empty the state hospitals, but oops, where are people going to go, right? And so then that's where you see the proliferation of homelessness and just all the other things that you guys know about very well. But those were all good training steps for me. And then I got a job as an in-home family therapist in a residential group home. And then I was working with families. And God, you laugh at this. We 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 use this, and y'all just stop me, because if you got a time limit, you just cut what you need to cut. But I'll get rolling. But we use this program called the STEP parenting program. Now, have you guys heard of the STEP parenting program? Now, I want you to imagine this: systematic training for effective parenting. It was very popular in the day. It was developed by a psychologist, university person. I apologize, I don't remember the name. I think in Oregon or Washington, I'm not sure what. But for a young budding therapist, it was gold, because I had a plan, right? I had a book, 6 chapters. And I would go meet with these parents and I would say, okay, we're going to read chapter 1. And I want you to imagine you're that parent, your child's in this residential program, you're freaked out, you're exhausted. And some wahoo young kid who's wet behind his ears comes in and says, we're going to let's read chapter 1. Oh my God. But I was full of vim and vigor. I was full of passion, and I encourage everybody to be that way. I just didn't know I didn't know what I didn't know. And there's one example of my education by families. So I was of that old mindset that you learn your knowledge, you learn what works from your esteemed professors, or from university systems, and then you go out and you you welcome the masses, and you show them the great secret to how to have a good life or whatever. And in this case, it was through the step manual, which, by the way, it's a very good program, but it's more geared towards white middle class, parents,
Right.
not the parents I was working with. And I had this one young boy who I just had such a soft spot. So I would go into the family's homes, and I would sometimes bring the kids with me. They get like time to go back home, and I would do that. And they lived in the Tenderloin in San Francisco, very challenging neighborhood. And I got my step manual, and I'm so excited. And he was living with grandma was the one who was the main contact. He's in residential care, dealing with lots of stuff, but he's excited. We're going to go visit grandma, and I'm going to do chapter 1 with her in the step, because I got this step kit. And she was this beautiful older African American lady, and we knock on the door. She opens it up. She, of course, embraces her grandson, and then she gives me a big embrace, and I've got my step kit. It came in a little kit. It's like a little carrying thing that you carried with you. And I was like, oh, I'm so glad to meet you. And the smells inside the house were just incredible. So she was cooking ribs, and she's had this barbecue sauce that she was very proud of. But I got things to do. We gotta do the step kit. And she said, oh, bless your heart. I guess she was from the South. I don't know if she was from the, but bless your heart. Oh, yeah. Yes, absolutely. That sounds so wonderful. But let's sit down and let's have some lunch first. And then, of course, as you can imagine, how the whole time we were there, we just ate, and we never opened the step kit. And I remember leaving and going back and being in supervision. And my supervisor was like, what did you do? And I was like, and I wasn't aware enough to really know what I know now. But I said, I don't know. I just tried to understand his world, living in, you know, so great lessons from in my early days. This is long before I got involved with programs like you're with, but that's back in California. So that all was that's I really do believe that's the formation of me. And in that process, I made so many mistakes, but I think people tolerated me because I was very enthusiastic, didn't know what I didn't know, and for the grace of whatever, was able to have some really good experiences. And follow that up with, we moved to North Carolina and interviewed for a job with the Department of Mental Health. And I remember if she listens to this, she's going to roll her eyes, but the person who would be my boss asked me, well, what do you think of the mental health system in North Carolina? And see, this is the part of me that you don't want to emulate. I said, God, it sucks. And she's like, what? I said, it really sucks. I said, there's no services for da 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 da. And my colleague, who I ended up working with later, tells a funny story about after I left the interview. The boss said, well, I think it's obvious who we're going to hire. And the other interview team, who were all wanting me to get it, they said, yeah, absolutely. And they simultaneously said my name while she said another person's name. But she was persuaded and hired me. But I guess I want to say before that, I had worked at the University of North Carolina Department of Psychiatry. They had a project, and you guys, you'll chuckle at this, but it was revolutionary at the time. It was a project called Alternative Care. And what we were looking at was comparing the effectiveness of a therapist who works in an outpatient mental health center, one-on-one in the office, traditional therapy. So half of my caseload was that. And then the other half was this wild thing called alternative care. Now, can you guess what alternative care was? No. Well,
Something
I'll tell you.
alternative.
Yeah, it was an alternative. It was doing things like helping somebody get their GED, or, God forbid, meeting somewhere other than the mental health center. So,
Work kind of stuff,
oh,
or
what? Blasphemy. Oh, no, what? Yes, that's exactly what it was. But think of the time. It was, well, I don't know, 1981, 1982. I don't remember. And this was like, exciting new stuff. And so I started doing my counseling sessions in prisons, in McDonald's, on the campus of the community college, anywhere but in the office. And it was like this light went off for me. It's like, oh my God, this is for me, feels like what I was doing working with a young man with schizophrenia, going out, sort of flipping the switch a little bit. And the other impactful thing about that job was the person who was running it, beautiful man, his name Bill Hollister. He's not with us anymore, but he's very involved in the Kennedy years of establishing the Community Mental Health Act and getting, because there used to not be outpatient clinics like there became. So he was very involved nationally. But I remember the first time I went with him, I was working in a rural community. I lived in Chapel Hill, but was working in a rural community. And he had this big old map. This is before Google. And he used to have maps in like a booklet. But his was unincorporated roads. So instead of, like, you guys are in Massachusetts, I don't know it well enough, but instead of, say, I'll make something up, going from Boston to somewhere else in Massachusetts, it shows you how much I know about Massachusetts. On the interstate or on a major road, we would go only on unincorporated roads. We would only get on the, now you think that's nuts, because it would take us much longer. But he said, but that's how you get the feel for the community of the people that you're working with. Again, it's an interesting theme of, you may be the smartest tool in the shed when it comes to some kind of therapeutic process or approach, but if you don't understand who you're working with, where they come from, what life is like, that you're nothing. And so I started doing the same. And one of my favorite places to stop, it was about 20 minutes before the mental health center, it was this house, and it was Miss Lottie's Antique Shop, and it's on the way to Southern Pines. Now, Miss Lottie was probably about, I don't know, 85, 90. She was really, really old. And she had this kind of rundown house, but she had her antique shop, right? Which was just stuff. And the first time I stopped there, obviously never would have gotten a sense of it if I didn't start doing the unincorporated roads. The first time I stopped there, it's not like it's on a major thoroughfare. And I stopped, and I enjoyed looking at old stuff, antiques, and I went in, and she asked me if I wanted some tea. And I said, sure. I didn't say no, didn't say I got to be at work. I said, sure. And so we sat on the porch in rockers and had tea, straight out of a movie, and just talked about anything and everything. So Miss Lottie became a regular stop for me, because Miss Lottie had a view of that slice of North Carolina that I couldn't get anywhere else. And it wasn't about, oh, I'm going to be able to use this. It wasn't, I wasn't thinking in that kind of direct, strategic way. I was thinking more of, just drink it in, absorb what it is you're dealing with. So all of that, I'm going to skip forward, because there's lots of others. Chaired a mental health board, and a human relations council, got involved a little bit in some of the local political dynamics of the community we were living in. Not a tremendous amount. But as a state official, then I became a state official in North Carolina in the Department of Mental Health, and started going to different national meetings. This is the beginning of meeting the people you work for at the university. And I was part of a group, it was called Families as Allies. And it was this novel idea. Barbara Friesen, I believe, is the person who wrote the grant to do this. It sounds so quaint now, but they were going to get 16 people, 8 professionals. I just love this. I was a professional. Thank you very much. And 8 parents. And I'm going to pair them up, write this curriculum, and then go around the country training on parent-professional collaboration. And it was, forget youth voice, guys. The youth voice wasn't even part of the conversation. at that time, not at all. That comes later, but the parent professional collaboration. And I remember flying into Portland, getting on the hotel bus, and there's a woman also on the bus, and we figure out very quickly that we're going to the same thing, and she's one of the parents. And so I proceed to tell her on the ride over without any pause for breathing or air. I sucked all the air out of the room. It's how important I was because, I was this hotshot from North Carolina, one of 8, and I'm exaggerating a little bit, but I'm like giving her all my credentials. And she very patiently sitting there. And when I finally stopped, she looked at me and she said, "Darling," she's from Vermont, but she said, darling, I got shoes older than you." And that's all she said. Again, oh, what a lesson. What a beautiful lesson about, guys, regardless of what else happens, listen, you know, listen. Your experience is your experience, but it's just your experience, right? If we're trying to bring people together, we got to listen. We got to understand. Anyway, so that led to getting involved with this thing called parent professional collaboration, called it Families as Allies. And it sounds funny to say this now, but it was such a novel concept. So we would go to conferences. We went to the ortho conference, ortho psychiatric conference, and I think there were 4 or 5 of us as a panel to talk about parent professional collaboration. I think it was in Miami. And we're in this ballroom, holds about 200 people. We weren't the main thing. We were one of the main breakouts. 3 people came. 3. We're in this big ballroom. Was it 3 or 2? 2 or 3. I don't remember, but it was like, because at the time it was like, what? Why would we involve families in that way? We're already involving families. They're our patients. And let's don't even talk about youth. Okay. Let's don't go there. Let's just stick here. So there was a lot of rejection, but there was also a lot of embracing and wonderful support. We had wonderful support by the leadership of the Center for Mental Health Services. SAMHSA wasn't even in existence then. Great support. So there was and from universities, there was great support. So it was a new concept. But once again, here I am involved in this kind of new and different thing. And then there was a meeting in Washington, D.C. to develop a 5-year plan for mental health. Folks at Georgetown were putting it on, and I got asked to be one of the facilitators. There were several facilitators. It was not about the facilitation of the meeting that really impacted me. It was at the end of the meeting. So the meeting goes and strategic plans developed, and then there was an opportunity for comment. And this group of parents stood up. I will never forget this. Barbara Huff can correct me. I want to say there were 6 of them lined up, and they one by one went to the microphone and basically said, all this plan that you guys have come up with, it doesn't speak to us. It doesn't speak to us, in this case, parents with young children who have emotional challenges. So you have the 2 primary advocacy groups, Mental Health America, NAMI, phenomenal organizations in their own right. But at that time, NAMI more focused on the population that I had worked with in San Jose. It was the young adults who developed serious mental illness, and Mental Health Association, who at that time were focused on group homes, more of a focus on group homes. And so, but they're the drivers. They're the power structures in the advocacy world. Great people. But this group of parents, small group of parents, just said, yeah, but you know what? Everything you're talking about doesn't really fit for us. And I just remember, and I wasn't part of that discussion. I wasn't representing a parent voice. I was a facilitator, but I'm standing behind them. I'm going, oh my God, this is it. This for our generation, for that time, I thought this is what I need to be doing. So I quit state government, quit the consulting job that I was in with a partnership with 2 other wonderful individuals, and decided I wanted to focus my efforts on this thing, this parent professional collaboration thing. Got on the board of the Federation of Families for Children's Mental Health. This is way back, guys. This is in the very early days where we used to put on conferences on a shoestring. We would develop the agendas in my hotel room the night before. I had to bring a printer and we'd print it out. So it was, it was very kind of a grassroots kind of thing. And I just absolutely fell in love with it. And I know we're going to talk about the Children's Mental Health Network later, so I'll save that. But suffice to say, that started this journey in working with federal government, in doing community assessments around the country, and having the great privilege to be in homes and community centers and churches. I think I've been in, I don't know, 47 out of the 50 states and both territories. And God, it's such a blessed life, to be able to really listen to people in all these different situations, to hear their voice, as opposed to a prescribed voice coming down from on high. So that, that's really long-winded, but you asked who I am or what I would want people to know. I think that's important that you know. And then in 2019, I have a Kundalini awakening, I have a spiritual awakening, and then I change all that and devote my life to work with people who are transitioning from this life to what's next. So, how's that for a mess? All right, hush, Scott.
No, I honestly, I was listening to every word you said. I think you have such a way of telling your story, but I also really appreciate just your ability to listen to patients, to those who really need to have their story listened to and to have their lives understood. And it brings to mind, we say this phrase a lot here, but meeting people where they're at, as opposed to, sort of creating this almost power dynamic with patient and provider, which is why I'm a big fan of peer work and peer
Yeah.
support. So it sort of sounds like you're intertwining those two by coming to their level, seeing what
Yeah.
their environment looks like, and trying to go from there and really give them care that would resonate with them.
Yeah, absolutely. And it's funny because my training was the opposite, as most of the training is. I can't speak to today. I don't know what you guys are being taught in school, but the power relationship in my early training was very clear. I was here, you were here, right? And it was those people that I've told you about and those experiences kind of bopping me on the head and saying, dude, wake up, that I'm so grateful that I was able to have all of those experiences because it really did shape me, and how that worked.
Yeah. Emily, I'm curious because you're on your way to becoming a therapist and you're about to
Yes.
finish your master's. Like, is there anything that Scott was saying that you are actually learning in school, or like what are your thoughts on everything?
Yeah, it is really interesting to hear you talk about like your own training because I know that that is definitely how it used to be and probably still is in like certain programs where it's kind of that more like, counselor client like
Yeah.
hierarchy type of, power dynamic. But yeah, one of the things that I really appreciate about the program that I'm in and like the internship that I'm doing right now, like and things that like kind of drew me to these are kind of that more like person-centered, like
Mhm.
meeting people where they're at, all of that type of stuff is something that's always felt really important to me. And so I am glad that that's stuff that I've been like learning and been focused on, but I know that that's definitely not always the case and definitely wasn't in the past. So it's really interesting to hear you talk about it too, where you kind of had to learn through doing it and like through your
Yeah.
own experiences. But yeah, I know it's the field itself has evolved so much. And I know that we're going to talk about it a little bit later, but
Yeah. And
yeah, it's
your
really
your
interesting to
your
hear.
university, I mean, it's no secret. I am such a fan of you guys. It's really exciting for me to hear you comment as a student, what your experience has been, because you're right, you don't find that everywhere, but your leadership team, some I know well, very well, they're walking the walk. So that's exciting to hear that. I'll tell you one other thing about the who I am in is that I had a professor in graduate school. So again, the graduate program I was on in the whole setup is interesting. Only 6 people accepted into it. So you're already thinking, oh, I'm pretty sweet, and I had this professor who was new to the university, and she came in well, it's like the first day of class. She's just introducing herself, and her I'll say her name. Her name is Jill Steinberg. I don't know where Jill is now, but this is at San Jose State University. I'll never forget her saying, "If I don't know, I will tell you I don't know." And we were just kind of like looking like, what? And so then on we go. So then after the class, it was kind of a ritual of going to a coffee shop that was close by. And the conversation for many of the people in who were in that class was like, "Oh my God, where do we get this loser? Seriously? Seriously. If you don't know, why are you a university professor?" That kind of thing. For me, it was like gospel. I thought, "Oh my God, do you know how freeing that is to be able to say you don't know? I'll be happy to figure it out, or I'll find out, or I'll research it, but I don't know." And that's such a hard thing for us to do collectively. But for me, it just freed me up. And that has been something that I've tried to live by, because those times when I try to fake it, oh man, those are uncomfortable. I don't know. So anyway, just
Yeah.
thought I'd throw that in.
Yeah. Oh, I feel like it definitely takes a level of humility to admit that you don't know something, and also vulnerability as well. It can
Yeah.
be scary, but I totally agree with you. But it's definitely a learned behavior to
Yeah.
open, and then, it's also contagious, I think.
Yes, it's beautifully contagious. I was just thinking about that example I gave you about the grandma and the tenderloin in San Francisco, who threw her food and just sort of embracing me and avoiding the step thing, say, "Oh, honey, you really don't know, do you?" You really don't know, and that's all right. We're gonna help you, but you're right. It is contagious, and it's such an important skill set for people to have.
Yeah. Yeah. I think, I'm definitely still working on it too. Learning to make mistakes and let people know when I've made mistakes, or when, I don't have the answers.
Yeah.
It can be hard and scary, but I really do think honesty is the best policy.
Well, here's some good news for you, or some tough news. I'm 67. I'm still trying to figure it out. So, but you just keep pushing. You just and then you catch yourself and you go, no, 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 no. Got to go this way.
Yeah.
That is not the advice you're going to get from everybody. I will be real clear about that, because that comes with its own set of rewards, and but also some things that are drawbacks, but none that were ever, to me, countered the rewards. Being able to be clear is the way to go.
I think that's really important. And yeah, and I really liked what you said, May, about, like you're still learning and it's still like scary, but yeah. And it is contagious too, how you're saying, where if you can be vulnerable and you can be open about, your mistakes and things that you don't know, then other people are going to have that sort of sigh of relief, Scott, that you're talking about, like with your professor, where it's like, oh, well, they don't even know either. So it's okay if I don't
Yes.
know what's going
Yes.
on.
Yeah.
And as you get later on into your careers and are in policy arenas and decision making tables, there's a real power in being the one who can be authentic in that way. And
Mm,
people don't think there's a power. People think there's a deficit. Oh, geez. Especially when you're in a room full of hot shots, like,
yeah.
I don't know,
And the
figure it out.
reality is, I'm not good at not being honest either. Like, people can
Good. I'm glad to
always
hear that.
tell. People, like my mother, I call her. She's like, "Did you make the dentist appointment I told you to?" I'm like, "Yes." She's like, "May, I know you didn't." Like, she can just immediately tell. And whether that's her like having her mom superpower, or just the fact that I am a bad liar, like I truly believe being honest with myself and others is the best way to go. You're
Yeah.
only cheating yourself.
Yeah, so true.
If you would like to contact us, you can email us at staytuned@umassmed.edu and check out the Transitions ACR website at umassmed.edu/transitionsacr. Thanks for being here, and be sure to stay tuned for next time.